Anyone who suffers a transient ischemic attack, or TIA, has an increased risk of stroke or acute coronary syndrome during the following year. Previous studies have estimated this risk to be about 12 to 20% during the first 3 months. The risk of stroke after a TIA can be estimated using the ABCD squared score, which is based on age, blood pressure on presentation, clinical findings of unilateral weakness or speech impairment, duration of symptoms, and presence or absence of diabetes. Urgent evaluation within less than 24 hours is recommended when the ABCD squared score is 4 or more. Has this recommendation for more urgent management of TIAs led to a reduction in the risk of stroke or acute coronary syndrome? The current study assessed over 4,700 adults from 21 countries who were enrolled in a stroke registry between 2009 and 2011. These patients had had a TIA or minor ischemic stroke within 7 days before evaluation by stroke specialists in a dedicated TIA clinic to expedite diagnosis and treatment. The patient's mean age was 66 years, and 70% had hypertension or dyslipidemia. More than 87% of them had sought medical attention within the first 24 hours after the onset of symptoms. The incidence of the composite primary outcome of cardiovascular death, non-fatal stroke, and non-fatal acute coronary syndrome was 6.2% at 1 year. Most of the ischemic strokes observed during the year of follow-up occurred within the first 90 days. Higher ABCD squared scores, multiple infarcts on imaging, and large artery stenosis were each significantly associated with a higher risk of subsequent stroke. Thus, the risk of cardiovascular events after TIA was lower than previously reported. A higher ABCD squared score, large artery stenosis, and multiple infarcts on imaging identify patients at higher risk for recurrent strokes within 1 year. Full study results are available at nejm.org.